Well, as we get ready to head back to school, you need to cross more than just new outfits and school supplies off your list. It's also a good time to make sure your kids are up to date on their vaccinations.
According to the World Health Organization, fewer children are on track with their basic immunizations in recent years, a trend doctors fear is only getting worse in the pandemic. I sat down with Dr. Avery August, a professor of immunology and a council member of the AAI, to talk about some of the biggest vaccine myths and what you need to know to head back to school safely.
Well, thank you so much for joining me here. I know August is National Immunization Awareness Month, so the perfect time to be talking about this as kiddos get ready to head back to school. We need to make sure that everyone is up to date. Why is this such a timely topic here with school right around the corner?
This is really timely, one, because kids are going back to school and we're thinking about protecting our children from infectious disease, but also the concern that we've had over the last few years about the drop in immunization rates among children, and that can lead to some really devastating effects.
Yeah, we've seen a lot of misinformation, especially in recent years, about vaccines making people sick or different problems. What are some of the biggest myths that you're having to fight right now when it comes to immunization?
So two of the big myths. One is vaccines make people sick. And this is a myth that's been debunked many, many times with many, many studies. The truth is vaccines do not cause disease. They actually prevent disease. And the second one is the safety of vaccines and that they have dangerous substances in them. Vaccines are not released for public use unless they undergo really rigorous clinical trials that first evaluate their safety, evaluate their efficacy, and evaluate how we can use them. And so by the time a vaccine reaches a physician's office, it has been tested and evaluated in many, many different people and builds on studies of many years in immunology, in virology, in vaccinology. And so by the time it gets to the public, we know that it's safe.
I think one of the reasons that myth about vaccines making people sick is so prevalent is the kind of a lack of understanding around how vaccines work. So how exactly do immunizations work?
So the way immunizations work is we use our fundamental studies in understanding how viruses and how the immune system works. And we take bits and pieces of those viruses if we're developing a vaccine against the virus, and we expose our immune systems to it by immunizing. And what that does is it trains our immune system in a way that doesn't cause disease. It just trains our immune system so that when you do, unfortunately, get exposed to that virus, your immune system is ready and is able to protect you from the effects of that infection. The other way to do it is, of course, to be infected, and that's what we're trying to prevent. If you're infected, you end up with the disease, you end up with the symptoms, you end up with the side effects, in some cases debilitating effects, and that's what we're trying to prevent when we immunize.
Right. Some of those long-term consequences, you just don't know how it's going to affect you. So what kind of vaccinations do parents need to be checking in on right now as they're checking over records, making sure kids are up to date? What do they need to be looking for?
So what we recommend is that children from birth to about 6 years old get the hepatitis A and B vaccine, the polio vaccine, measles, mumps, rubella vaccine, and of course chickenpox. And for children who are between 7 and 18 years old, there's the HPV vaccine, which prevents certain cancers in children. We've developed at the American Association of Immunologists a website, aai.org/NIAM. And that includes a lot of information, resources about the types of vaccines that are available and when they can be delivered to children, as well as other links for access to vaccines.
All very good information for parents as we get ready to head back to school. Doctor, thanks so much for your time this morning.
Thank you for the opportunity.
And we've got more information about vaccines, what's required for your school district, and more to get ready to head back to school right now on KOIN.com.